Welcome back to Dolor Factor Live here on DBS. Of course, we're talking about cancer, and in the studio with me we have Dr. Owen Gabriel and Rufus Bousquet. And I'm going to go through a couple of the questions that we have time for. Okay, here's a statement actually. Wow, I'm so impressed with Mr. Bousquet's braveness. It takes a real man to talk so openly in full public view about such a sensitive issue. Please ask him for me, if prior to the symptoms he described, if he ever had an issue with hemorrhoids, reoccurring ones, that is.
No, I never had an issue with hemorrhoids, and in fact, I will say this, fortunately for me, the actual cancer in my colon was located, away from the hemorrhoid area, and as such, it alleviated one of my biggest fears, and that is that they would have to cut around that area and you'd be wearing a bag, which sort of interrupts your quality of life. So fortunately I didn't have to deal with that, but certainly in terms of hemorrhoids, no, there were no increased level of that.
All right, thank you for answering that. Okay, here's one. When the prostate is surgically removed, does that mean that there'll be no testicles after?
Well, the prostate and the testicles are separate organs, so absolutely you keep your testicles, and it's a completely distinct procedure. Do
you think there are many men out there who actually think that's why they don't go to see the doctor, because they have a misunderstanding and they think that their testicles are going to be cut off, so they're just not going to go? Yeah. No, we're laughing, but it could be castration. It is, but there are people who might think that.
Well, it's possible. I mean, anything's possible. I mean, when you're consumed with fear, you might think anything. But more than that, I met an individual, for example, very quickly, because I know we don't have time, who had his prostate removed, and so he admitted to me that now that's it for him. Sexually, he's dysfunctional. Of course, he seems to be quite happy, so that's okay. But he tells people that. So obviously, if he told some individual that, the person might think, well, look, I don't want to get in that position, so they may delay, getting themselves checked. It's possible. Sometimes people feel, I just don't want to know.
Yes. But what is the truth, really, doctor, when we talk about prostate and sex?
So there's such an intervention called surgical castration, where we do remove the testicles, and that is to reduce the presence of testosterone, which would feed, let's say, the prostate cancer cells. So there is that intervention. It's specific for certain types of patients who may not be able to have other types of interventions for whatever reasons, maybe age and other comorbid conditions, hypertension, diabetes, they are inoperable. There are a number of things that that can lead to making that kind of intervention. But if you have your prostate removed, it doesn't mean that your testicles are removed at any one time.
Okay. Is cayenne pepper good for prostate cancer?
Well, I'm not versed too much in the natural medication questions, but I do know. I mean, I'm a believer that natural foods are helpful in ensuring that you have a healthy organism that is prepped to fight any type of disease.
Okay, here's another one. Just quick answers, please. Can prostate cancer paralyze you from your waist down?
Okay, if prostate cancer has spread in stage 4 and affects the cancer cells have gone in and affect your nerves that come from your spinal cord, and those nerves are the ones that may lead to your ability to move your legs, then you have a problem with movement. So in that sense, if you have a stage 4 prostate cancer that has affected the nerves that allow you to move your legs, then you probably be less inclined to be able to walk adequately.
Okay, when it comes to cancer, which sex has a greater chance of survival?
That really depends on what kind of stage that you've diagnosed the cancer in. If you talk about the incidence of cancer, probably you'd say men are probably in a statistical manner more affected with cancer. But really, as far as survival is concerned, it really depends on the kind of cancer you have, and the stage of cancer that you have.
Okay. I asked you a question, we haven't got that answer yet. When I said to you, when it comes to the prostate and sex, is it true that if you have your prostate removed, or does it mean that there is no sexual activity at all? You cannot have sex, full stop?
Well, we alluded to that earlier on. There's some interventions that are nerve sparing, if it's surgically done, that will allow you to continue to have a healthy sexual life.
Okay, that's much clearer.
In most cases, some medications that you take will result in the reduction of your sexual appetite, and so on. So there are you know, nuances where that is concerned. It's really specific to the patient that you're dealing with.
Okay, well, I'm really sorry that I have to say goodbye now. The time's just flown really quickly. Any last, very quick last words for the future? First, I'll ask the doctor and Rufus.
Well, I'd like to emphasize the need for a wholesome, healthy lifestyle. The fact is, you do not need to be sick to see your doctor. I think, you know, it's about routine checkups, annual checkups, proper checkups, and that kind of commitment to ensuring that you have a positive outcome if something is diagnosed, because you're on top of it. And that's what I'd like people to learn from tonight's program, that you take charge of your life and your health. Okay,
thank you, Doctor. Rufus?
Well, I mean, in the same vein, what I will say is that for me, the real issue with cancer, knowing our people culturally and historically, I just think that a lot more has to be done at all levels to try to assist people with this, because it's a very expensive disease to fight and to diagnose, to also, you know, it's really expensive. And so I think people need help. And I can't leave here without saying, you know, that I have not had the privilege of meeting the lady Dorothy, who is in charge of Faces of Cancer, but certainly I see the work that she does, I see the emails that she sends out and so on, and I really believe that she's doing a fantastic job. And kudos to her, and I look forward to the opportunity to meet with her at some point.
Well, thank you. Thank
you so much. Shame on me that I haven't.
Well, you took the words out of my mouth. But thank you so much for being with us, and you know, all the best in the future.
Thank you.
But before you go, you both have the last task to perform, and that is our giveaways. Doctor, I'm going to start with you. The question was, name 2 risk factors and the 4 most common types of treatment for prostate cancer to win a free consultation for 1 person and a family member. And the recipient is going to be, now here's the answers: the risk factors, family history and being African American, and 4 treatments: observation, surgery, hormone therapy and radiotherapy. And
so our lucky winner is Gideon Augustine.
Okay, so Gideon has received that. Okay, good luck to him. Well, Gideon is no stranger to us, so we know how to contact him for Fanfetta. Thank you so much, Doctor. Now, question 2. Rufus, you're going to be doing this one for us. The Make Yours Brilliant Solutions new car care kit includes 7 differently precisely selected products to wash, dry and wax your car. Name any 4 of those products, and you will win a lovely kit.
Anika Jean.
Anika, well, Anika Jean. All right,
absolutely.
Anika, you've got a lovely gift. If you don't appreciate it, the man in your life or the men, your father, your brother, will. So congratulations.
Congratulations to
yes,
Anika,
definitely. Okay, now the answer to that, I should say, you could have mentioned any of the following: microfiber wash mitt, ultimate wash and wash and wax, ultimate wax endurance tire gel, foam applicator pad, water magnet, microfiber drying towel, a supreme microfiber towel. My gosh, all that's inside there. Wow. Okay, brilliant. Now you have until next week to send in the answer to this one. Provide 3 colors that make up Infinity Color Shop's logo, and the winner will receive $100 off a purchase of $350. Airline Jules, yes, Airline, you're surprised I've said your name. You are a Dolor Factor fan, and we're giving you an Optimist Club 50/50 ticket as a thank you for being with us. But if you win, you must give me some of the share. Haha, no. If you win, you must take me to Tapas on the Bay for a lovely sangria. And that means we've purchased a ticket for you for $20, and you will have a chance to win $5,000. And let us know if you win. Okay, more information on the optimistclub.stlucia.com or contact us on DFL. Thank you so much to everyone who participated in tonight's giveaways, and thank you so much to my 2 guests, Dr. Gabriel and Rufus BOUSQUET. Thank you.
Thank you.
Now, if you'd like to watch this program again and all of DBS's live shows, visit dbstvstlucia.com. Also, remember to join Clinton Reynolds this Saturday on the Press Club following the DBS Evening News for discussion of the week's headlines. A reminder that Infinity Colour Shop, along with Carrasco & Son Limited, Castries, Soufriere and its Nexa Auto Colour Shop located at Bibitel, is continuing a post-VAT 20% discount on all retail products up to December 31st, 2012. Now, participate in the How Well Do You Know St. Lucia Nobel Laureates quiz. This week's question is, what year did Sir Arthur Lewis receive his Nobel Laureate Prize, and what did he receive it for? Send your answers to nobelquiz@dolorfactorlive.com. For all media personnel, don't forget an important day this weekend. The Media Association of St. Lucia officially launches the association this Saturday, the 1st of December at 7 p.m. at the Bay Gardens Beach Resort and Spa. For more information, visit www.masl.lc. December the 1st is also World AIDS Day, so there'll be free testing offered in the Viewfort Square in the morning and at the Baywalk Mall in the afternoon. The day will end with a candlelight vigil and concert at Baywalk Mall in the evening. So go and get tested, and remember, self-protection for AIDS prevention. Next week on DFL, we're getting ready for Christmas. Yes, so you know what that means. A show with a Christmas theme and lots of giveaways from the Ionola Lounge at Huronora to La Place Carenage, and gift ideas with something for everyone. And don't forget, Baywalk Shopping Mall has lots of pre-Christmas sales and events on now. But even as you celebrate the festive season, remember, cancer is a disease. It's a very horrible disease that affects many and sometimes seems to choose its victims for just no specific reason. Unfortunately, signs of cancer are often gravely ignored, whether it's due to ignorance, fear, or lack of finances. But like so many other conditions, waiting can be fatal. So please stop procrastinating and face your fear. Do your annual checkups regularly and make additional visits to the doctor if you ever notice anything's amiss. Don't self-diagnose. The Oncology Center is there to help you determine exactly what, if anything, is wrong with you. Knowledge and prevention is a must, and we've provided you with enough information to get you on your way. Now you must take the next step to prevention and cure. Fortunately, help is available, from free health service at health centers to emotional and other support from organizations like the Cancer Society and Faces of Cancer. So please utilize these resources. Make an appointment to see your doctor tomorrow. Tomorrow. Why? Because DFL asked you to. Thank you for watching Dolor Factor Live. On behalf of our guests, Dr. Owen Gabriel, Rufus Bousquet, the DFL team and DBS, I'm Delia Dolor. Good night and God bless.